How does this system compare to the Canadian system? Pros and cons.
Yeah, I think there are a lot of comparisons to the Canadian system, but there are also a couple of differences. One is the Canadian system was developed province by province. It didn't start off as a national system, but it was developed province by province. The other thing that is different, will be different for ours is, and it's related to that, is we're not starting from scratch. Well, they weren't starting from scratch either. Anyway, we've got a lot of capacity in the system that Canada never had and doesn't have now. So that's another difference. We've got more MRIs, we've got more hospitals, we've got more cardiac labs. We've just got a lot more capacity than Canada does.
We got a lot more people.
And I get a lot more people.
Phil is right. The real comparison with the plan that I described is not with Canada. It's not with France, not with Switzerland or Scandinavia or England. The real comparison is with the plan we all have who are over 65. It is, can we make the Medicare program national? Can we invite everyone in this country from 0 to 65 into the system and provide them with care? Now, older people use more resources than younger people. I think we all know that. We're using, our age group is using about $10,000 to $12,000 per year per individual in that group. But people 50 to 65 don't use that much. And if you talk about people 20 to 35, they don't use that much at all. But if the money that was in the system were put into the Medicare trust plan, then everyone would get the care they need, even though the younger might be using less. But they're packing it away for the older folks, just like it is now. And that's where the similarity with the Conyers plan is. It's not with Canada, it's not with England, it's not with these other countries. It's with our own American solution to a very important problem that was resolved by LBJ and the Congress in 1965.
Medicare doesn't currently pay for long-term nursing home care. So what's the plan under this new proposal? Would that be included? And how about hospice care?
All of those will be included, and Phil can comment on this as well, I'm sure. If you go and pull up the website for Conyers 676, and it's on the computer easily, you will find that he includes all of those services. Preventive services, primary, secondary services, tertiary, long-term care, rehabilitation,
Dental,
mental health. Mental health. Dorothea Dix is jumping up and down. Because the mental health system in this country, if you think the healthcare system is a disaster, don't get sick emotionally, please. This will be included in the system. And long-term care, and nursing home care, and hospice care, and home care services all will be expanded. And they can all be done within the budget that is currently available to us in that $2.3 trillion that is out there.
One says, since primary doctors are scarce, should nurse practitioners be able to have a business like a doctor?
Let me do that. I love nurse practitioners. Nurse practitioners in the state of Arizona can practice independently. There are some scope of practice problems with having your own office, but it can be done. I know that because I've worked on those issues for a long time. Unlike physician's assistants. Physician's assistants cannot practice independently from a physician. Nurse practitioners can. But to the question, I was at the State Health Department for 6 years, and I ran the programs that were in place to try to get doctors into areas where they were needed. The question about whether we have enough doctors in this state or in this country, I'm not sure about. The research is all over the place. What I do know, though, from my experience is that the doctors we do have are badly distributed. They're not in the places where people need the care. So what a Conyers plan would do, or what mine says explicitly, I'm not sure whether Conyers does, is that you could because it's a single payer, you could provide incentives for people to go and do things that they wouldn't ordinarily do. And we know that works. We've had a program at the state of Arizona for 10 or 15 years now. I ran it. It's a combined federal-state program that's called loan repayment. And what loan repayment is that when doctors finish their training and they owe all these bills for their training, you make them an offer and you say, we'll help you, or we will pay off those loans if you go work in Holbrook, or if you go work in Winslow, or if you'll go work in Douglas. And it works. So the Conyers plan potentially, and mine explicitly, would do that. The salaries would be adjusted in order to provide an incentive for doctors to go to the places where they're needed.
But we have a question really that relates to this lawsuit issue, saying how would lawsuits be handled?
Well, that's the point I'm getting to.
In situations regarding malpractice.
Exactly the point I'm getting to. The AMA had one issue: tort reform. And yet, the best way to have tort reform is to have a relationship with your patients. You know that the people who are sued least are not the best doctors, necessarily. They're the family docs who have a good working relation, who sit down and hold the hand of the patient when they're at the bedside, who ask them how their business is doing, and how their life is, and how their kids in college when they come in. That close working trust relationship reduces. There's a story I had from North Dakota when I was there. There was a guy whose license was being taken away by the medical society, by the medical examiners board, because the guy was found alcoholic. He was an alcoholic. He was a drunk in the operating room. Now that's a bad quality doc. Yet at the hearing, he came from a little town, Beulah, North Dakota. At the hearing, there were 300 people at the hearing. Don't remove Dr. Jones from our place. We love Dr. Jones. He's the guy who's been taking care of us for years. He doesn't get sued. Malpractice would go down in this country if we had a system of the type we're talking about. The other thing about it is, the rates for malpractice insurance, because you will be sued, doctors will be sued, they do things, we are all human, we do things wrong. But since most of what is recompensated when you lose a lawsuit is the future health care, you know, if you cut off a guy's leg, you got to have the wrong leg, he's got to have rehabilitation and all the rest. So that's not a good example, but if you do something where he's going to be sick for the next 30 years and your insurance has to pay for that, that goes away.
For information on the United States National Health Care Act, go to conyers.house.gov.